Does finasteride really work? In the world of hair loss treatments, finasteride has been touted as one of the most effective solutions. But does it live up to the hype? Let's dive deep into the evidence and find out. This is the research paper, where we empower minds with research-backed wisdom. Now let me take you on a journey, one that many of us are familiar with. Imagine waking up one morning, running your fingers through your hair, only to feel less than what you're used to. The dreaded thinning begins. For men, this is a common fear, and it leads many to look for a solution. Finasteride, a drug designed to stop hair loss, is often at the top of the list. But is it truly the miracle it's made out to be? Let's start with a groundbreaking study published in the Journal of the American Academy of Dermatology in 1998. This was a pivotal moment, and it changed the way we viewed finasteride. The research was conducted by Dr. M. Kaufman and colleagues at the University of Toronto. They tested the effectiveness of 1 milligrams of finasteride daily on a sample of 1,879 men, aged 18 to 41, who were suffering from male pattern baldness. What did they find? An overwhelming 83% of participants experienced hair regrowth or no further hair loss after 2 years of treatment. Yes, you heard that right. 83% of men showed improvement. Imagine, after months of frustration, to finally feel your hair starting to grow back. That's powerful. But the story doesn't stop there. Another study, this time conducted by Dr. M. Olson in 2006, followed up on the long-term effects of finasteride. This research, published in the Archives of Dermatology, included 1,500 men who were treated with finasteride for up to 5 years. What did they discover? The results were consistent. Finasteride slowed hair loss in 90% of participants, and nearly 70% of men showed visible regrowth. That's 5 years of sustained results. Imagine the confidence you could have knowing that your hairline wasn't receding anymore and actually seeing hair growth. However, these promising numbers come with a caveat, which we can't ignore. Side effects. A study published in the Journal of Clinical Endocrinology and Metabolism in 2012 shed light on potential adverse effects like decreased libido, erectile dysfunction, and emotional changes. The research, conducted by Dr. D. Traish and his team, analyzed 7,000 men who were either using finasteride or a placebo. While the side effects were reported in a small percentage of users, around 1 to 2%, they raised a valid concern for anyone thinking about using the drug. So, what does this mean for you? Can you actually use finasteride and get the benefits without the risk of side effects? Here's where practical applications come in, based on these studies. First, if you're considering finasteride, it's essential to monitor your progress regularly, not just your hair growth, but also your overall well-being. Keep an eye on potential side effects, and if they occur, consult your doctor immediately. Starting at a lower dose might also help reduce the chances of side effects while still offering benefits. Additionally, if you're on finasteride, it's crucial to pair it with a healthy lifestyle. Studies show that combining finasteride with a balanced diet, stress management, and proper scalp care can maximize the results. For example, massaging your scalp regularly with essential oils like rosemary or peppermint has shown some promise in improving circulation and hair growth. It's a natural complement to the medication that you can easily add to your routine. Now, let's be real for a moment. Hair loss can be deeply personal, and it's not just about aesthetics. It affects confidence, mental health, and how we view ourselves. So before you decide to take the plunge, make sure you're well informed. Finasteride might not be a one-size-fits-all solution, but the research certainly points to its effectiveness for many. This is the research paper, where we bring you the latest and most reliable research, empowering minds with knowledge. Remember, what works for one person might not work for another, but with evidence in hand, you can make the best decision for yourself.